Hello, I'm Jeremy Fernandez. Coming up on the virus, Australia announces a one-way travel bubble with New Zealand that could see Kiwis visiting within weeks. Plus, frustration grows across regional Victoria as towns and cities are forced to wait for case numbers in Melbourne to fall before restrictions are eased further statewide. But first, the US President Donald Trump has confirmed that he and the First Lady Melania Trump have tested positive for coronavirus. Mr. and Mrs. Trump are now self-isolating at the White House. The couple was tested after one of the president's key aides, who'd been travelling close to them, tested positive as well. On Twitter, the president said they'll begin the quarantine and recovery process immediately and that they will get through this together.
We're measuring, trying to make sure we get some additional contact tracing on folks that have been to the White House. We're watching as the White House is doing its work as well. So yeah, we'll certainly be careful, but we've been awful careful for months and months and months, and we're doing our best to keep everybody safe. All my whole team, everybody who's both back in Washington and traveling as well. Nobody with symptoms. Everybody says they're all feeling good, and anybody who says they've got a symptom or something, we'll make sure and take extra special care of them. But we feel like we're in pretty good shape, and the medical team has cleared us to take this next stop here in Croatia. And we'll do that, and then we'll hop back on the plane, and I'll give you a further update then. It'll be morning time in Washington. I'll give you a further update then as well.
Well, for more on President Trump's announcement that he's tested positive for COVID-19, I'm joined by political scientist George Rennie from the University of Melbourne. George Rennie, welcome to the program.
Good to be here. Thank you, Jeremy.
Now, how much of a surprise is it that Donald Trump has contracted COVID-19, not just because of how sceptical he's been about this whole pandemic, but also, this is a job that exposes him to a lot of people who are themselves exposed to a lot of people.
A good question for an epidemiologist, I think, but unsurprising in that sense. We know that Trump has been a great skeptic of wearing a mask, for instance. He's avoided shaking hands, but he's always been that way inclined. He's a famous germaphobe. So unsurprising in the sense that he's been holding mass rallies that we know make the spreading very easy. But I think the bigger issue is that, again, it's the Hope Hicks news. So his key advisor contracted it. That was the news this morning from my in my end, and I and many others wondered, well, gosh, her contact to Trump must make it very likely that the president himself, among others, might contract it.
Does that indicate to you that this may have gone deeper into the leadership of the United States, and what are the implications of that?
Well, the implications, to use a phrase that Trump likes to use, often are huge. We already know that Trump has contracted it. Again, senior advisor Hope Hicks had contracted it. There was the news much earlier in a political sense. This morning's news in our time. Melania Trump has contracted it. There is a distinct possibility that many in the White House have contracted it also, and indeed that was why the mooch, as he's known, Anthony Scaramucci, was on cable news not so long ago saying that the West Wing is in a state of panic. Who knows how many people have contracted it, and the fact that it necessitates a lockdown causes almost unprecedented consternation.
They have been exercising some isolation, haven't they? I mean, Mike Pence and Donald Trump have spent minimal time together, same with Mike Pompeo as well.
Yes. And it's precisely because of the coronavirus that they've been doing that, and precisely because of this threat that they've been doing that. And so there is a line of continuity in terms of if Trump becomes so sick that he can't, that the 25th Amendment needs to be invoked, then Pence, one would assume, is okay. But it's that funny thing about government. You can have a barrier, as it were, between two characters, as in Trump and Pence or Trump and Pompeo, among others. But you can have these indirect lines of contact. Again, it's the epidemiologists must be screaming at the screen right now and saying, well, it's not as easy as creating those immediate barriers, let's say.
Tell me, you mentioned this idea of continuity. What is the plan B and plan C here? Should Donald Trump become gravely ill at some point in the next 2 weeks?
Well, the Constitution is clear. The cabinet can invoke the 25th Amendment, and then the vice president takes over. And then there's a line of succession beyond that. Ironically, that line of succession goes to Nancy Pelosi after Pence, so that's an interesting thing. But if Trump were so infirmed, then again Pence would take over, and one assumes that Pence is suitably quarantined from Trump. But yeah, it would create a constitutional crisis, and that's one of the reasons why, even though the Constitution is clear, ironically, it would still create a crisis of government, I should say. And that's one of the reasons why we're seeing this panic. Not the only reason, but one of them.
As you know, this campaign, particularly at this tail end of it, has been absolutely chaotic. The debate told us that the other day. What does that mean for the rest of the campaign over the next just over a month?
Well, it changes the game. We've already seen that. Look, I think you can tell it's a major event internationally. Or you can tell a major event when every single newspaper around the world basically says the same thing. And every newspaper in the world and every media outlet in the world right now is saying that the President of the United States has contracted a virus that is very worrying for someone in his various categories, age and
the fact that he's overweight as well.
That he's morbidly obese, yes. And Herman Cain recently actually passed, a former candidate. So yeah, worrying in that sense at the minimum. But how does it change the campaign? Well, in many respects. One is it really brings into starker, it makes it even more obvious that healthcare in the United States is a big issue and the coronavirus is a big issue. And we already saw that those were two of the biggest things that were discussed in the most recent debates. And of course, they were, in terms of the analysis and the polling that we've already seen from the most recent debate, they were Trump's weakest areas. And so suddenly the very man that was saying, well, it was essentially ridiculing the idea of wearing a mask, and most recently trying but not succeeding in claiming that he was always always well positioned to tackle the coronavirus, which very few Americans actually buy. It really brings it into stark relief. It makes Trump look like a hypocrite. And the interesting thing is, normally, if someone gets sick, if a president gets sick in particular, but if anyone gets sick, we suddenly feel sympathetic for them. But in Trump's case, there's a real worry that the Democrats are going to be able to, present their best face right now and say, aren't we all worried about the president? But later on, hit him hard. I'd just quickly say, if Trump does recover, which I think is very likely, he literally has the best healthcare in the world. If Trump does recover, then that's a talking point for the Democrats, not for Trump. It allows the Democrats to say, well, look at all the other 74-year-olds who died. Look at all the other 74-year-olds who didn't have the best healthcare in the world. And look at what happened to them. It's chaos.
Can I ask you just very briefly what this means for the supporters of Donald Trump? I mean, he's been pointed out as a hypocrite before. Does this materially change the game for them now that he is diagnosed? Will they show up in fewer numbers at the ballot boxes?
Well, there's two types of supporters. There are the diehard supporters who are frankly unchangeable. It seems as though there's a low base of support for Trump, which is around 35%. The high point of Trump's popularity is at most 50%. So there's that range. And so, again, there's 35% of Americans who are basically locked in. They're not going to change their views one iota. But elections are won and lost every single time by the swing voters. And the last debate exposed Trump in terms of the swing voters. There were many swing voters who didn't like the way Trump handled it. But this, I think, it has a real chance to change their minds in particular. And has the potential, hypocrisy is not a good term in politics because hypocrisy occurs all the time. But when you have such obvious contradictions and someone, when it's this bad, then yes, it has the potential to shake up the debate. But, Trump has this amazing ability to defy expectations in many regards. So I'm saying that with a sense of caution.
He does overcome, and I have to say, the statistics are certainly on his side. George Rennie, it's been terrific having you on the program. Thanks so much for joining us.
Great to be with you. Thanks.
Well, here at home, case numbers are easing and the tough restrictions are slowly coming down. Today, the first stage of a trans-Tasman travel bubble was announced. From October the 16th, New Zealanders will be able to visit New South Wales and the Northern Territory quarantine-free.
This will allow New Zealanders and other residents in New Zealand who have not been in an area designated as a COVID-19 hotspot in New Zealand in the preceding 14 days to travel quarantine-free to Australia. So there's a 3x3 definition. It is 3 days with less than 3 cases. We're making sure that for those people, if they've been in New Zealand in that 14-day period, then they're welcome to come.
Now, New Zealand's Prime Minister Jacinda Ardern isn't as optimistic, suggesting it's still too unsafe to reopen the border to Australians. Ms Ardern urged Kiwis to spend their tourism dollars domestically and says those who do come to Australia will have to self-isolate when they go back to New Zealand.
Even if Australia, and we've acknowledged that they may open up borders one way for New Zealanders to go in without quarantine, that doesn't mean that they won't have to go into quarantine on return. In fact, at this stage they will. And so I encourage New Zealanders to think about spending their dollars here locally. The reason for that decision for us is safety. In our view, we are not ready to have quarantine-free travel with Australia. They have a very different strategy to us, and so they're making that decision, and that is their prerogative. But for now, we of course have to keep our New Zealanders safe.
In Victoria, infection numbers are still relatively low, but there is concern about a cluster in Melbourne's southeast. 11 cases have been linked to the popular Chadstone shopping centre. Staff at the Butcher Club in the Fresh Food Precinct have all been put into isolation after a number of workers there tested positive. But regional Victoria continues to record no new COVID cases, and some businesses are frustrated at being prevented from opening up further. The Premier is sticking to his plan to wait for case numbers in Melbourne to fall before regional areas are allowed to take the next step.
Classes at Brian Ford Swimming Centre in Traralgon have been cancelled since the start of the state's second lockdown. But with regional Victoria now virtually COVID-free, he has a simple message for the state government.
What more do we have to do to prove that we are ready to open for the next stage? We're ready to go.
Regional Victoria has reached step 3 of the reopening plan, but sport and hospitality businesses operate under tough rules. Wodonga's Birralea Hotel is restricted to just 70 patrons when it has room for almost 700.
I do feel for Melbourne businesses being totally closed, but our cases up here are just non-existent, so we need to reopen.
But on the current roadmap, regional businesses can't open further until the whole state has gone 2 weeks without a new case. And even then, relief could be some time coming.
I would just caution against any great expectations that we can go from 20 people inside to 50 or 100. We know that indoor settings are 20 times more dangerous.
Adding to the pain in Victoria's border communities, just 5 minutes away in New South Wales, the rules are far more relaxed.
The bridge is only a K away and you can cross the border and all that sort of stuff. It doesn't make much sense, but I do understand we are Victoria, but I think Mr Andrews needs to have a look at it.
And clubs and pubs and their poker machines are up and running.
Every day we're losing people across the border.
The 14-day rolling average in regional Victoria is down to just 0.3 cases with no mystery transmissions, satisfying the requirements to move to the last step in the recovery roadmap. But with Melbourne still stuck at stage 2, it seems the gap between city and country is as wide as ever.
Metro's doing a great job. There's no doubt about that. But regional, we're a month ahead. It's a fact.
A struggle to keep their heads above water. Jared Whittaker, ABC News, Traralgon.
It's a different story in Queensland, where more restrictions have been eased, including measures around public gatherings and the state's border. Standing, eating and drinking is now allowed at bars and restaurants around the state, and the cap on private gatherings will be bumped up to 40 people from next month. Queensland will also reopen its borders to all of New South Wales from November the 1st, as long as New South Wales can maintain no community transmission for 3 more weeks.
Their health experts are also concerned about some undetected community transmission at the moment. They're about to go into school holidays. So we will be watching that space very carefully, and Dr Young will be watching that space very carefully.
Tasmania too is reopening its borders to people from low-risk states who will be allowed to travel there from October the 26th without the need to quarantine. Those states are South Australia, WA, Queensland, the Northern Territory and the ACT, and possibly New South Wales.
I want to stress, and I've said all along, that if at any time the situation changes in these jurisdictions and the advice is that the risk is increasing or too high, then we won't hesitate to change this decision. As I've consistently said, we're simply not prepared to put Tasmanians at risk, meaning that border restrictions will remain in place for the time being with Victoria, and as I've said, we will keep under advisement for the next week New South Wales.
WA's Premier Mark McGowan has also softened his state's hard border stance. From October the 5th, travel rules for people coming from New South Wales will be brought into line with all other jurisdictions, with the exception of Victoria. People travelling to WA from Victoria will still be required to quarantine, but can complete their isolation at home rather than at a hotel. They'll still be tested for coronavirus on arrival and on the 11th day of their quarantine period.
Today's announcement is a way of reflecting the declining case numbers in Victoria and New South Wales and allowing us to better manage people coming from both of those states, using both technology and home quarantine so that we can free up hotel spaces for Australians returning from overseas. So this is an important step forward, but at no point in time I'll put it this way, this is an important step forward, but we are not ready to announce any date whatsoever on bringing down the borders with the East.
The global death toll from coronavirus has now passed 1 million, and health authorities are warning that's probably an underestimate. More than a fifth of all deaths are in the United States, and more than a third are now in Latin America. These are just some of the countries in that region that are of increasing concern. The toll in India is also continuing to grow. To help stop the spread in developing countries, the World Health Organization has announced a deal to roll out rapid tests.
After more than 6 months, Santiago's zoo is again welcoming visitors. Lockdown measures in Chile have been among the longest in the world, but for now at least, almost all restrictions have been lifted.
If we do not respect the measures, and if the number of cases increases, then we are going to have to move backwards.
Low testing is one of the barriers to opening up. It's hard to slow spread if you don't know where the virus is. The World Health Organization says countries shouldn't open up while more than 5% of tests are coming back positive. At the end of May, more than a quarter of the tests done in Chile were positive. It's only this week that the country got that number below 5. But testing capacity is still a problem for many countries. In Mexico, more than 40% of tests are still coming back positive. Australia is among the best in the world, with just 0.5% of tests in the past week being positive. The WHO has announced plans to distribute 120 million rapid tests.
This will enable low and middle income countries to begin to close the dramatic gap in testing between rich and poor countries.
The test requires a nose or throat sample and looks for proteins expressed by the virus. Results show up within half an hour.
So these tests are almost like pregnancy tests. You just take a swab in front of the patient, you just open the card and put the swab on the card.
Latin America, which is averaging around 40% of the world's COVID-19 deaths, will be targeted, along with African nations.
Even 120 million tests over 6 months, while a massive increase over what has been available so far, represents a fraction of what is really required.
4 rapid test manufacturers have been approved in Australia. It's not yet clear when they'll be available. Casey Briggs, ABC News.
And that is the latest edition of The Virus. I'm Jeremy Fernandez. Thanks for your company. Stay safe. Bye for now.